Here we are. Okay, so I'm on the Facebooks here. Got it. And pull this down, and we can begin. All right, so this workshop is for you if you're dealing with clicking, you have noise in the shoulder, your limited range of motion, or you sit majority of your day and you're wondering, hey, how come my shoulder hurts? Like everybody's stuck working from home, right? Or you don't have any shoulder problems and you want to keep it that way, right? Or you want to improve your ability to move, to play, to exercise. You want to enjoy life. This workshop is for you, okay? The things that you're going to learn are simple ways to improve your shoulder mobility. Two key muscles that we need to work on that are not your rotator cuff. You probably, if you're familiar with shoulder issues, you probably have heard of the rotator cuff, and we're not going to talk about that because everybody talks about that. And the thing that most people miss when stretching the shoulder, a lot of times exercise is easy to come by. You can kind of just look up on YouTube and say, hey, this is an exercise for tight shoulders. But doing the exercise correctly is sometimes difficult. All right, next. What's in it for you? What's in it for you? Who wants to improve their shoulder stability? Who wants to have a healthy rotator cuff, a healthy shoulder joint? You want a strong shoulder joint. You want to reduce your risk of injury. Who wants that? You want to raise your hands, tap in the chat, tell me, tap in me if that's you. If this is you, right? Awesome, Spence, awesome. You want to eliminate pain? That's all. We're going to go over that tonight. But the big thing is that I got to tell everybody, because I'm a physical therapist, this is not physical therapy. This is, just a disclaimer, right? That we're going to be going over information that is super helpful, but is targeted at a broad population. So, I post videos online too on YouTube, and they're general tips. But if you're looking for the solution to that specific problem that you may have, you need a customized assessment and treatment plan so that you can learn the root cause of your specific dysfunction and have it fixed, right? You can't have general things that's made for the general population, but you'll see that the information that we're going to go over is super valuable that you can do at your home right now or tonight. All right. And if you stay to the end, this is the thing that gets me excited, because I thought about this before going on. It's like, should I do it? Should I not? I'm going to get a special offer for you guys staying and hanging out with me. It's a Thursday night, 7 p.m. I'm going to give you a special offer. All right. So who am I? Who is this guy? Well, let's kind of get into this screen. This is me. I'm Dr. Paul Cachoa. I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey. And I've been a PT over 20 years. I got my doctorate in 2010. My purpose, my goal is to help active adults like you move better, feel better, and play better so that you can avoid pain, get rid of pain, avoid injections, avoid surgery, avoid pain meds, even if you tried physical therapy before, because not all physical therapy is created equal. PAR5 Physical Therapy is a little different. All right, so what are we going to cover today? Let's dive in. We're going to cover 3 tests for your shoulder health, the 3 stretches and mobilizations to improve that overhead flexibility and mobility, and also the 2 mobility must-haves that you have to maintain, to maintain the above things. All right, and the thing is that I was telling a previous client earlier today that had shoulder issues, your body will adapt to the positions and postures that you put it in. So if you put yourself in a bad position, if you do an exercise or stretch, you might undo that progress if you get into a bad position throughout the day. So we're going to cover what exactly is that as well. All right, so the stretches and the exercises that we're going to go through, just a reminder, don't push through the pain. We want to make sure that we're going to hold these stretches for longer periods, go gently into them, and we want to combine them as much as you can through your daily routine. You know, you're working from home or working if you're in the office or whatever, try them out throughout the day. You know, there isn't a thing like your perfect posture when you're working at home. It's your best posture, your perfect posture is your next posture. The human body is made for movement. It's not designed to sit in a static position for any length of time. So every 30 minutes, at the very least, we want to be able to move, get out of position, switch, keep yourself mobile. The stretches that we're going to go through, you want to hold them for at least 30 seconds. You can go up to 60 seconds, but anything shorter than 30 seconds of a stretch really doesn't cause enough permanent change in the tissue to be effective. Anything short of 30 seconds, it kind of just gets stretched and then kind of snaps back into a shortened position. You want to avoid that, so you want permanent change. Hold it for 30 seconds, if not longer. All right, so if you remember anything tonight, remember this next video. The body functions on an alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. All right? So for example, for the shoulder, it's blue. That joint needs to be mobile. The next joint down, which is the scapula, the shoulder blade, that needs to be stable. And the mid-back, the thoracic spine, is also blue. That needs to be mobile. And you go out to the elbow needs to be stable. So you can see how this alternating pattern happens in our body. When it comes to a certain joint, if we only focus on that joint, like say the shoulder, then we're not going to address anything above or below that joint. Then we don't get to the root cause, and you always have this issue that may resurface again because you haven't addressed the whole chain. Our body is a system of systems. Everything is connected. You know the song, the hip bone's connected to the leg bone? This is the same thing, except more functionally, okay? So a couple exercises or tests that we're going to go through to see what type of quality of movement that you have today is the latissimus length test. The latissimus is a long muscle that's in your back. It starts from your lower back, goes all the way up, and then inserts into the front part of your arm. The reach, roll, and lift test. I just did this with somebody earlier, and surprised they failed, and we kind of worked through that. And the Yoakum test. All right. So let's go through this. This is the lat length test. So what you're going to do, let me see if I can pull this up here. You're going to get on a wall, all right? You're going to make sure that your head, shoulders, and hips are against the wall, all right? So your knees are bent. You don't have to be that low that you saw in the picture. You can just have them bent slightly, but as long as your hips, shoulders, and the head are against the wall, you're going to try and flatten your back as hard as you can against the wall using the abdominals, and then arms straight, thumb up. You're going to try and touch that thumb to the wall. If we lose contact from the wall, from your lower back, if your lower back loses contact, or you cannot get your thumb to the wall, you have a tight lat, latissimus muscle. We'll talk about what that means and how do we fix that later. The next is the reach, roll, and lift test. It looks like this. It's basically getting onto your hands and knees. If you cannot get into this position because of knee limitations in range or hip limitations in range, you can certainly do this in a chair with a table in front of you, okay? So we're going to kind of demonstrate that right here. I'm going to kind of tilt my camera down to my table. We're going to get into a position where we've got the back rounded out. So we've got the hips down to the heels. The picture didn't have the forehead on the fist, but we're going to put the forehead right on the fist like this. And then the hand that we're going to test, the shoulder that we're going to test is going to be the one that's out here. We're going to basically keep that head on the fist. We're going to walk that hand forward. We're reaching forward. We're going to roll till the palm is up to the ceiling. And then lift, keeping the elbow straight to lift. See how that goes. All right, go slow, go easy. I know it might be difficult because it is a very compound test to test out your thoracic mobility as well as your scapular mobility and strength and stability, and then lower trap strength. So if, I had a client come in earlier and we tried this with him, and basically when he went to lift the arm, he bent the elbow. So that's a compensation. Our body will work through the path of least resistance. So if we put yourself in a tight, wound up position and you say lift the arm, you're going to be like, all right, let me lift the arm. I'm going to bend the elbow. So if you bend the elbow, that's a fail. All right, the Yoken test, super easy. You can do that in standing. You just take your hand, put the fingertips on the opposite shoulder, and then bring the elbow to your face. You need to be able to touch. If you can't touch, what does that mean? That means that we have a positive impingement sign, which means that the space in the joint, basically the shoulder joint is like a ball and socket, but that socket is like a T on a golf ball and a tee. It's a very shallow socket. And where that socket points, that says, all right, do we have space for that ball to move around the joint? The Yoakum test tests for impingement. Does the ball get pinched up on the bottom part of the upper socket? All right, so we've got the lat test, we've got the reach, roll, and lift test, which tests for lower trap strength and thoracic mobility, and then we have this Yoakum test, which is impingement sign. All right, so some stretches. How do we get these structures stretched out? So we're going to go through the latissimus stretch. The video should be playing, I think. Yes, awesome, it works. It's basically in this half kneeling position. Oh, did it stop? Yeah, it's buffering. Anyway, you get into this half kneeling position with this stick, and the stick is just to hold your hands apart. You keep the hands apart with the elbows together, and then you bend forward, bringing the elbows up, and that creates the stretch to the lat. All right. If that stops, we're gonna show it. Yeah, there it is. So what we're gonna do is I'm gonna go grab my stick, and then we're gonna talk about this. Grab my PVC pipe. All right. Let me get this special PVC pipe, the most special one that I have in my bag. My bag is filled with so many PVC pipes. Let's go and take a look at this stretch and talk it through. So I've got this stick. You can use a broom handle, doesn't matter. We're going to get some type of surface, be it a table, be it a bench, a couch, doesn't matter. We're going to put the elbows on top of that table, couch, bench, whatever. We're going to keep the elbows nice and tight. The closer the elbows are, the bigger the stretch is going to be. We're going to grab the stick, bend one elbow, and straighten the other. Now this is where the secret sauce is. Keeping the elbow bent and this one elbow straight, that separates the hands on the stick. I'm going to keep my elbows together. I'm going to roll this stick, rotate it up so it's like this. So now it's parallel with my body. I keep my elbows together, close together. I keep my hands apart. And then I take my trunk, my hips, and I bring it back. Head goes down into the arms, and that's a big stretch. Super aggressive. If it's too aggressive for you, again, go gently into these stretches. Don't push through it. You could reduce the intensity of the stretch by just keeping your elbows apart, and then bend the elbows as you go down. Don't bring your elbows super tight. Super tight, super intense, wider, less intense. Okay? All right, so let's get back into my other slide here. All right, so the next one's going to be the first rib mobilization. The ribs, let's fast forward, there we go. First rib mobilization, or MOB, kind of pushes on the first rib here. Now, a lot of times this rib will be elevated because of the tightness of the neck. The tightness of the neck pulls that rib up, which interferes with the collarbone as it rotates up and back, or supposed to rotate up and back, to get you to this overhead position. Usually the first rib, collarbone complex, that interface is implicated when you have pain at the complete end range. So if you're okay with that lat length test that we did against the wall, but you're having a pinchiness at that top end, this is the stretch that you want to do. You get a PVC pipe or something with the ball at the end to make it a little bit more comfortable. You put it on the wall, apply that downward force with your body position, and then you bring your arm overhead and you repeatedly go through that motion to loosen up the joint and mobilize that. Okay? All right, so again, there are ways to make this more intense or less intense. Again, these are general tips and stretches to try and work. If it doesn't work for you, let me know. Type it in the chat. If you're having questions or having problems, let me know. And you know what? The other thing I want to do is I just want to take a time out here. We're 20 minutes in. I want to make sure that I make this as individual and specific and helpful and full of information for you guys here spending your Thursday night with me. So what I want you to do is in the chat room, if there's one thing that you want to cover tonight to make it worth your time, type it in the chat or the Q&A box or something to let me know that there's something specific that you want me to go over. All right, so before we're done tonight, I want to make sure that we make this as valuable as possible for everyone here. All right, the next thing, we're going to go into exercises. All right, we've talked about how the shoulder is supposed to work and how that ball is moving in your socket. The other thing is how that socket faces. What direction or what position is that socket face? When you go overhead, that shoulder blade needs to rotate up, and it needs to rotate up so that socket faces up and allows the rotator cuff to work in a proper angle to support the arm overhead. Okay? So the muscles that rotate the shoulder blade upward create a better platform, right? It says right there. And it improves the stability and strength. The muscles that we're most interested in is the serratus anterior, which comes from the lower half of the shoulder blade and wraps around into the ribs. That pulls that bottom part of the shoulder blade up. And the lower trapezius, which comes from the middle part of your shoulder blade and pulls that point down, so it rotates the top part down, and the serratus anterior rotates the bottom part up. All right. So serratus anterior, the movement that it does is called protraction. It just takes the shoulder blade and pushes it forward. All right. So this exercise right here, I'm lying down on my back. I've got this band wrapped around my elbow. I don't straighten the elbow. I'm just driving the elbow up, and that protracts the shoulder. It just takes the shoulder and then moves it forward and backward. This is another position here. It's on your hands and knees, kind of just pushing the shoulder blade forward and backward, not moving the elbow, and that activates the serratus anterior. This is another one, rolling the foam roller up the wall. I have it on the rig, makes it much more difficult. You put it on a flat surface on a wall, it's going to be easier. So pushing that elbow forward or pushing your shoulder blade forward activates that serratus anterior. All righty? So one of the most important exercises, anybody that comes in to see me, we look at that motion, we look at the quality of upward rotation of the shoulder blade to make sure that it's functioning well so that you have less impingement and full range of motion. The next one is the lower trapezius. The lower trapezius pulls the shoulder blade down. Let's see if I can, no, it's not playing. Flip over here. There we go. Hopefully that gets it started. This is an overhead press. I have the band attached in front of me. It's basically forcing me to pull my shoulder blade back and down as I lift my hand up and a little bit out. Kind of give it a little bit more space in the shoulder. It doesn't have to be tight like this. That makes it super hard. A little bit of space is okay. We're just going to come up in that 45-degree angle if you can. The band pulls me forward. It's really about trying to pull my shoulder blade back and down. All right? Thumb pointing backwards is the key. Don't forget that one. All right. I have this picture up here. These are the shingles of a roof. You know, if you want to improve your shoulder range of motion immediately, you can work on your posture. And the thoracic spine, the mid-back, the joints in the mid-back, they function like the shingles of a roof. If we bend forward, the top shingle moves forward. If we go backwards, the top shingle moves backwards. All right, so that's why I put this up. It's kind of demonstrating how the mid-back works. We want the thoracic spine to be straight. So if I'm going to go back to my single shot here, take this out, and if I take my arm and I raise it overhead in the slouch position, this is pretty much where I'm going to go. I can't go any farther because this is a strain. If I don't move my arm and I just take my spine and I straighten up my spine, that raises the arm, right? So it seems, it feels like common sense, but a lot of times I see people that come in and they're in this position. They're hunched over, their head is forward, and they're like, why can't I get overhead? Well, low-hanging fruit, if we just improve your posture, then we get this overhead position. So that's one thing to kind of look out for. And the exercise or the mobilization for your mid-back is your thoracic spine rolling on a foam roll. So there's a couple ways to do this. I think like using a foam roller is one of the easier ones. You can get foam rollers anywhere, really. And this is one of those exercises that can be uncomfortable when you first start to do it, but it gets easier the more that you do it because the more loose and flexible the joints are, the less painful this movement is. Okay? So you could use a peanut, these two balls together. That makes it more intense, but using a foam roller to start is probably sufficient enough. Okay? This mid-back is also responsible for rotation. So like those shingles, we can move one shingle down and back by rotating to the same side. So this is an exercise that we can kind of get into that reach, roll, lift, test position. We lock out the lumbar spine by getting into that child's pose with the hip and knee bent. And then we kind of just put the hand behind the head and then just rotate up. You could alternate that with the hand behind the back to get the lower thoracic and then rotate that same way as well. Now, when we do this, we want to make sure that we're rotating on the axis of the spine. We don't want to rotate and have any side bending with this move. So I'm going to go back to this and then show you how this rotation works. We'll get rid of this. So rotation, so the setup is the same way that we had before. We've got one hand, and the hand that's going to be on the ground or the table here is going to be lined up between my knees. Elbow, fist, straight, forearm between the knees, and the hand will go here, rotating up like this, or behind the back, rotating like this. Now, if we look from the head-on position, if I can do this without falling off, we're going to be rounded out, but I don't want you to side bend as you go around. I want you to keep your head over your fist as you rotate, okay? So watch out for that compensation when you're doing that stretch, okay? Again, the body will work through the path of least resistance, so you want to make sure that you're very strict with the exercises or else they're not going to be effective or you might injure yourself. All right, so this is a picture of the muscle, and more importantly, I want to point out the fascia, which is basically all this stuff that holds everything together. Another name for fascia is the epimysium there, the perimysium, all those things. The white stuff that's filling in all the spaces, that's fascia. And the muscle, as it connects into the bone, is called a tendon. So it translates that fascia turns into the tendon and connects the muscle into the bone. And that's how we create movement, by creating tension to the muscle, tension to the tendon, and moving the bone. Now, tendinitis or tendinosis, these are some terms that you might have heard when you're dealing with shoulder issues. This is what it is. Tendinitis is basically inflammation in that tendon, all right? And that usually happens after some type of overuse injury or something, and then goes away within 72 hours, more or less. Now, what it's replaced by is what we call tendinosis. And tendinosis is a chronic issue in tendons, and that's why tendon pain kind of lasts for weeks and weeks. It's not really inflammation. The inflammation goes away, but the structure and the environment that the tendon was in when it was inflamed changes, and the fibers of the tendon become disorganized. They become frayed a little bit. Small tears may happen. You think about like a shirt. If a shirt is wrinkled, those fibers are not straight, they're not flat, they're not organized. It's sort of like that with the tendon. If it's not organized, it can't transfer the force well from the muscle to the bone, and then we have pain when we do activate that tendon. All right? So one way to address tendinitis or tendinosis is what we call cross-friction massage. Cross-friction massage is a manual technique to break up those adhesions or knots, to realign those fibers, and we combine that with eccentric strengthening or the lowering phase of a muscle to make that tendon stronger and make it more robust and tolerant to activity. So cross-friction massage, let's kind of go over that a little bit. One of the common areas where people have shoulder pain is right down the front, and that is kind of like where your bicep tendon lies, right in front of there. And that's one of the tendons that is easily impinged in the joint up top here. So the cross-friction massage is basically taking two fingers and kind of strumming it across the fibers of that muscle. So if we think about the muscle fibers running straight down the arm, we don't want to go up and down. We want to go like a guitar string and strum that across. And, you know, the more pressure you can apply, it's whatever you can tolerate, right? We don't want to do it where it's super intense and it's super painful. We do want to go deep enough with enough pressure that we get to the tendon, which is deeper to the deltoid muscle, and with enough force that we could feel that we're moving one layer of tissue over the other. If we go too light, we're just going to move the top layer. We want to go deep enough so that we move the bottom layer over the other layer. So that shearing creates that friction, and that massage creates that breaking up of the tissue, the adhesions, and realigns those fibers, and we kind of pair it up with exercise to make the tendon stronger. All right, so I put this book in here because basically that's how our body functions. The soft tissue that we talked about, this fascia, the muscle, the tendon, is basically stacks of tissue that need to move and slide. So if you have like a book at home and you took the book and then kind of moved it back and forth or bent it with it closed, you could see the pages sliding on one another. It's kind of like the tissue in our body. All the tissues, as we move, one part needs to slide on one another. And you think about like an old book or a book that's been sitting on the shelf for a long time. It's been compressed by the other books in there. It's been stuck. Maybe the pages are a little sticky, and it's not as easily mobile. It's not as easily sliding. That's what happens with our tissue. We want to restore those sliding surfaces. So to do that, we do what we call soft tissue mobilization, or self-myofascial release, whatever it's called, STM or SMR. You know, we basically create like a pressure gradient, creating like a fluid pump. It's also creating that shearing force of that separating of the layers, but also it can help to relax the muscle. And relaxing the muscle, there's also like neuromuscular component to it that you know, if you're super tense or super stressed, the muscle tends to be on a higher tone, higher level of alertness, versus like when you're relaxed, on vacation, no worries, and things are a little bit more chill and relaxed. So your peace of mind, your frame of mind, I guess, your stress level also plays in a role into how tight muscles can get. All right, so we talked about the latissimus before. We're going to get that foam roller out again, and this is one way to kind of loosen up or do some soft tissue work or soft myofascial release, self-myofascial release onto that lat muscle. We're going to be lying down on it. It's kind of pinning through that armpit area just to the side of the shoulder blade, and we're going to go rolling through there. And when we do something like this, I generally have people do it for 1 minute to 2 minutes per body part. And again, the first time that you do this, it might be uncomfortable. You kind of progress with time and with pressure, go lighter first and go into it heavier. So this is another release for the pectoralis. The pec muscle is kind of like right through here in the front part of your chest. And we're using the lacrosse ball to pin that down. We're rolling it on the rig, or you could use like a door jamb. And then we're taking the arm through different directions to pin that muscle down and stretch it into the opposite way. Okay, and again, this is something that I would do for 2 minutes. 1 minute to start, maybe 2 minutes if you can. All right, so we touched on this a little bit before. We want to reduce the tone of the muscle, and a muscle will only relax if your brain allows it to. So We have your nervous system, your central nervous system. We have this fight or flight reflex and the rest and digest reflex. Um, this rest and digest is what we want to try and tap into, the parasympathetic nervous system. So when you're breathing and rolling out, you want to use your breath and breathing to calm down your nervous system and relax the muscle. So I always have people, when they're doing some type of stretch, to relax the muscle, you're going to go only nasal breathing, in and out through the nose, 2 seconds in and 4 seconds out. So it's a 2-second quick inhale and a 4-second exhale. You could pause your breath at the top or bottom, wherever you feel comfortable. It's all nasal breathing with an extended exhale, and that'll tap into that parasympathetic, that rest and digest nervous system, and relax the muscle and make the rolling a little bit more tolerable, and also allow that muscle to stretch and elongate. Okay? So we talked about the latissimus length test, the reach, roll, lift test, and the Yoakum test. If you've been following along and doing some of these things that we've been covering, you could try those tests again and see if they feel better. Because it's always really about, if you have a pre-test and do some type of intervention and then test again, you should see a difference or feel a difference. If you don't feel a difference, then that means that whatever you did in the middle, whatever intervention that you did, didn't work. You need to find a measurable change between pre and post to make sure that your hypothesis, your treatment plan, what you think is the root cause of the problem is correct, and you're addressing the right issues. Okay, so that's why it's so important to make sure that we get a thorough physical exam to understand the root cause of the problem and address it. All right? So let's talk about what we learned tonight. We learned about the lat stretch, right? To stretch that out. We learned with the stick, right? We learned about that first rib mobilization using that ball and the stick in there. We learned the importance of the serratus anterior muscle, rotating that shoulder blade up in the proper position to get that full overhead range, and also its connection with the lower trapezius muscle to rotate that shoulder blade down. By the way, the trapezius muscle is a large muscle. It has 3 parts. It has like the upper trap, which comes from the base of the head out to the shoulder. It has a middle trap, which goes from the shoulder blade out to the spine, and the lower trapezius, which comes from the shoulder blade down into the mid-back. It has 3 parts, and it can only mostly contract one over the other parts. So oftentimes when people come in, they have an overactive upper trapezius. This muscle right here feels tight. Oh, it feels tight. You get a massage or whatever. If that muscle, that upper trapezius, is overactive, it inhibits the ability for the lower or the middle trapezius to work. So you want to make sure that when we're trying to get that lower trapezius to fire and work correctly, we want to make sure that we draw attention to that, make a stronger brain to muscle connection to the lower trapezius, have that be more active than the upper trapezius. We got to turn this off and turn the lower trapezius on. So we have to do soft tissue work up here as well to make sure that that is able to turn off. It's not chronically up and tight and short, so that we can get that lower trapezius working well. All right, we talked about also the thoracic spine, how that needs to be mobile and straight so that the shoulder blade can work well and the shoulder can go into a full overhead range. Cross-friction massage, we talked about how to do that on specific tendons that may be painful, that need to break up adhesions. And that's something that we do here in the clinic as well. And also different variations of soft tissue mobilization or self-myofascial release. All right. So let me see if there's what we have here in this Q&A. Somebody said, I like my shoulders, stop clicking when I do lifts in the left arm. All right. Noise in the joint is very common. All right. Now, if noise happens in the joint as you're moving it around, we say, all right, 1, does it hurt when you hear that noise? Or 2, is the joint locking up when you hear the noise and then unlocking as you get through there? So is it a sticking point, or is it just like, hey, I got the noise, right? Noise happens as our body moves, and depending upon the status of these joint surfaces, that can contribute to noise in a joint. The noise in the joint could also be gas that's in there that kind of gets popped, and there's like cavitation, there's like suction that happens. That can create that click, that noise. And there's also tendons or ligaments that roll over the bumps of the bone. That can also contribute to noise. So when someone comes in to say, with noise, we look at, all right, what's the root cause of that noise? And is it pathological? Is it a problem that we need to focus on? Or is it something that is just created with moving surfaces? So that's a kind of like a complex question. If you want it to reduce in clicking, typically if we increase the mobility of the joint and move it around, we facilitate production of what we call synovial fluid, which is kind of like the oil of your joint. The more synovial fluid we have, the more lubrication we have. That may reduce the clicking sound in your joint. Otherwise, we have to kind of dive in a little bit deeper and unpack the reason why that happens. All right? So let's look at our little thing, our special discount. Thank you for spending your Thursday night with me. The discount that I want to get into is this healthy shoulder diagnostic. What is that? What is a healthy shoulder diagnostic? It's basically where we take 60 minutes. We're going to go 60 minutes through an interview, injury review, goal setting, total body diagnostic movement screen. We look at your complete body from head to toe, because if we don't look upstream or downstream from where the problem is, we're going to miss the root cause. We do a posture assessment, we do strength and flexibility testing, we do treatment, and then we talk about exercise recommendations that you can do at home or in the gym or anywhere. At the end of this, you'll know the root cause of your issues, and this will be the first step to getting a pain-free shoulder. All right? Typically, this healthy shoulder diagnostic is $225. All right? But for you guys, I'm going to put it down to $97. So $97 for a healthy shoulder diagnostic, that's like more than 50% off. So I want to help you guys as much as possible and make this as valuable as possible so that you don't have to live with shoulder pain or have noise and not be able to enjoy the things that you want to do. My goal is to help everyone move better, feel better, so that they can play better and enjoy life. It sucks to be in pain. It sucks to not be able to move and do things that you want to do. All right? But, I've helped thousands of patients in my career with same problems that you might be experiencing. And, we go on to get people to their goals so that they can live a fulfilling life. So that link right there, and I'm going to put this in the chat here. You could use this link to schedule your healthy shoulder diagnostic. All right? These are a couple of reviews of past clients that I've had in the past. I've seen this CrossFit athlete that came in. She had a torn labrum. We were able to kind of rehab her and get her back into doing CrossFit. So I have another guy who, 79 years old, he had a bicep tear, and he's been to other PTs, and he wanted to get back into playing golf, pain-free. And right now he's in Florida right now, having fun. He's being able to play multiple rounds a week. So it's one of those things that I enjoy to see, that when I'm able to help these people enjoy their retirement, enjoy their life, not be limited with pain, and have fun. Another guy here, he had seen multiple PTs. He'd gone to other different companies for the same problem. And he's gone long times, like 3 times a week for 3 months. No change, right? But then when he came in to see me, he was 50% better at the end of each session. My goal is that if we do the correct diagnosis, treatment plan, and we do what we think, we address the root cause, you should feel 50% better by the end of the session, right? If we didn't, then we need to rethink, and then maybe we refer you out to someone else. But, most of the time I'm able to get people at least 50% better in each session. And I don't see people 3 times a week. Because I run only 1 person per hour, I'm able to do a lot of stuff hands-on with patients and optimize the time that they have with me so that they can spend their time doing exercises. I don't have you come here and we're just going to count reps and have you do exercises that you can do at home. If you can't do it at home, it's all about maximizing the time that they have available with me And then I give you exercise videos and check in with you weekly to build some accountability so that making sure that you're doing the right thing. All right? You know, the other thing too is this workshop special. So this is the thing that I was excited about in the beginning. Because you guys are stuck with me, let me see who is still here. We've got another question here. Molly, can you send a link in the chat? Is blurry on the screen? Yes, I put it in the chat. You should see it there, Molly. Okay. And no pain, it does move. Now I just put pressure on it. Okay, so feeling okay, pretty good. The chat is the link, but before you even click that link, this is something else that I was thinking, you know what? Let me offer you something else. This workshop special is only available to you guys right now. So that previous link that I put in the chart, put into the chat, that's for everybody. Again, $225 for an hour session. You get it for $97. But if you do this tonight, and this is only going to be available tonight, this workshop special, I'm going to give you a free stretch and recovery session. That's 30 minutes of percussion massage and manual stretching. And I usually do this for athletes that come out of the CrossFit gym here. They're feeling sore, they're feeling tight, athletes that need a little bit of recovery. We get them on the table. We do a little bit of percussion massage and some stretching to relieve some of that muscular soreness, and they leave feeling looser. So that I'm going to offer, and it's only available tonight. And here is the link. I'm going to put this in. All right, so people are saying that they don't see it in the chat. I'm going to put this in here and see. All right, you know what? Here we go. Everybody, here's the workshop special. There you go. You should see that right now. Again, the free stretch and recovery session only available tonight. The $97 healthy shoulder diagnostic, usually $225. You only get it for $97. So you're getting an hour and a half of treatment for $97. All right. So hopefully you see that. I mean, like, let me know if you're missing it. Oh, yeah. So someone else said that they didn't see the link. Hopefully you guys can see it now. I made sure that I made that available to everybody. Awesome. If you have any questions, you're unsure, like, who is this guy? I don't believe him. You could definitely contact me. I'll give you my info right here. PAR5 Physical Therapy. You can go to the website, read a little bit more about what I do. You can email me, you call me, that's my cell phone. You can call or text me at that number. If you have signed up for this, you already know that you get text and email messages from me, from my email and from my text messages to give you reminders of, hey, we've got a workshop tonight. So it is almost, we got 13 minutes. I'm going to be here. This is my contact info. I am going to get back into this screen right here. And if there is any questions, I'm going to stay on until I answer all of them. If not, we're going to close it up. All right, so where is the location? All right.